ambulance service is the patient breathing?
My name's Kim, I'm on the ambulance crew, all right?
This is the Scottish Ambulance Service.
We genuinely get to make a difference in people's lives.
The job literally is life and death.
No needles or anything on them though. There's nothing I would rather do than this.
Serving every one of us.
It's okay, love. It's all right, don't worry.
From Scotland's busiest cities to its wide open countryside. Wherever we have fallen, whatever has happened to us.
Need a hug. She just feels she's gonna die.
But this is a service under extreme pressure.
We're constantly apologising to people.
Yeah, it's very busy down here.
Which we rely on like never before.
We're 2 shifts down in the Edinburgh and 3 in the Borders. Here we go, here we go, here we go!
On the front line and at the other end of the line.
1, 2, 3, 4.
Scotland's paramedics keep Scotland safe.
Breathe the gas!
And alive.
Help is coming, they're coming as fast as they can.
This time, paramedics suspect sepsis.
The higher the score, the more likely a patient has sepsis. We've got a score of 11.
Breathing problems in an Aberdeen nightclub.
Okay. Oh, no. If you had to put a number on the pain, Aaron, 0 being no pain, 10 being the worst. 9. 9.
Yeah.
And a man who's fainted.
Well, I knew I was staggering and fell to the floor.
Gets a surprise diagnosis. Ambulance crews in Paisley cover a huge stretch of west central Scotland, from cities to the sea. It's a busy station, dealing with over 1,000 call-outs each month.
We need a bag of wipes.
Paramedic Pete and trainee technician Karen are working together for the first time.
You got everything, Karen?
Just need to check the bag and put the blanket on the bed.
It's Karen's very first week in the job.
I love the job. I love being out on the job, but it is a lot different from training school because at training they can teach you what you need to know to go out, but they can't give you every single scenario that you'll ever encounter.
The relationship between crew members can take time to build, but it's an important part of being a paramedic.
Is it true you changed your name by deed poll?
Yes.
Why was that?
Because I hated my name.
Really?
Hated my name. Sorry, Mum.
Well, now, don't be such a Karen. So you changed the spelling?
Change the spelling. It's not that. My whole family still spelt my name with an E for like the next 3 years.
Today, they are heading to Greenock, nearly 20 miles away.
I just go, yeah.
Yeah. Sent to Fleet Department.
Yeah. You know Greenock well?
No. I know, obviously, where to go in the general direction.
So we've got an 82-year-old female has a community-acquired pneumonia.
When you're out on the road, you don't have that controlled environment to say, can I ask a question? You also have to make sure that you are the kind of person that's going to speak to your senior clinician that's with you.
What a view up here, eh?
Amazing. Can I stop and I speak up?
Yeah.
In Greenock, Sarah is giving her family some concern.
You get cold, Sarah? Not right, aye. Sometimes people your generation have got 2 names, you know, that way, like, you know, you don't want to put your foot in it, you know? I'm just talking to your daughter, Dan, just give you a bit of peace now, alright? Just getting a wee story about you. So tell me what's been happening with your mother?
got chronic bronchitis, COPD,
Did she?
loads of different stuff to do with breathing.
Okay, so COPD, heart failure, bronchitis, what else have we got?
Asthma, chronic bronchitis, emphysema, that's it.
So this lady was discharged from hospital 3 weeks ago after a 9-week admission with community-acquired pneumonia. Since being home, she's struggling to regain her her usual form. She's been kind of weak, tired, reduced oral intake, reduced mobility. And the family were concerned, particularly the last 24 hours, they were concerned that her breathing had deteriorated. The GP had come out, assessed this lady, discovered that she also had a productive cough, coughing like kind of green phlegm, kind of mucus, but also, more importantly, her oxygen levels were low.
But she couldn't even get up for the carers this morning, she couldn't move.
Have you noticed, other than today, have you noticed a deterioration in your mum? How long do you think?
It's been going on for a while now.
How's your mum, cognitive-wise? Is she normally very alert?
She used to be, but no.
Does she have memory problems or like dementia?
It's getting that way, it sounds.
Everyone is affected by dementia differently. So as a strangers going into our house, that's distressing for anyone, never mind someone who's suffering with dementia. 38.1.
38?
Yeah, 0.1.
We use a tool called a National Early Warning Score, and this is a tool that helps us identify patients who are at risk of deterioration and death, regardless of the underlying condition that they've got. Depending how abnormal the measurement is, the more critically ill the patient is.
Did you give her anything like paracetamol or?
No. The doctors prescribed her cocodamol now, the strong ones.
Right.
But we couldn't get her to take any yesterday at all. Just kept falling asleep with it in her hand.
Alright, I'm just trying to cool you down. You've actually got a bit of a fever here, alright? We're just going to give you a wee bit of oxygen here, Sarah, okay? Just to help your breathing, alright? Are you sore anywhere?
Yeah.
Where are you sore?
Oh, oh my toe and the feet. Well, her feet, it's just her feet are all sore. It's the feet.
But if you notice, is it a breathing deteriorated? Is it
That's only from yesterday, overnight.
Right.
It's just, so it would just keep getting worse and worse now.
So it's even at rest, not just moving around?
At rest you can hear the crackle more.
Your mum's breathing rate is very, very fast. It's probably 3 times faster, all right? And her oxygen levels were low.
Sarah's vital signs are not good. Coupled with the sudden weakness, this is a red flag for the paramedics.
See, every observation that we take, all right, you get a score, all right, 0 to 3, all right? The higher the score, the more likely a patient has sepsis. So anything 7 or more, a query, high risk for sepsis, okay? She's got a new score of 11, all right? Sepsis is the immune system's overreaction to an infection or injury that is life-threatening, can cause tissue damage, organ failure, and can lead to death if left untreated. All right? Listen, darling, we're going to get you out of the hospital, all right? See if we can get you better, all right? The doctor, I think you've got a wee chest infection, okay? Patients with dementia, ideally you would not like to take them out of their own environment, all right, unless it's avoidable. In this case, there's no option but to take her to hospital. She is kind of critically unwell.
Banff, Aberdeenshire. The station's 15-strong crew attend around 150 incidents a month across the northeast. On shift tonight are trainee paramedic Josh and paramedic Lisa.
So it's a red call for a 20-year-old male, and it just says that he's got difficulty in breathing.
And where is he?
He's outside a nightclub in Aberdeen. I think we'd all be lying if we said that, you know, your heart doesn't sink when you're being called to the likes of a nightclub or a pub, because automatically you just know that, you know, there's going to be alcohol involved. You're going to be in and around the general public, and probably quite a number of the general public, which is never an easy situation to treat people. Isn't it? Like underneath there. He's pointing that way.
That way, so.
down there.
Extreme caution.
Hiya. Is it Aaron, is it?
Yeah.
Aaron, we'll get you on board and we'll take a wee look at you. In this case, it was absolutely fine. He was actually outside waiting for us with his friends, and yeah, they were all really nice. Do you want to tell me what's been happening, Aaron?
I've never had anything like this before.
Okay.
I had a cigarette.
Okay.
And then I went downstairs, and about 2 minutes later, my, I don't know what's it called, the diaphragm.
Okay.
Whenever
I see a finger here.
breathe in, it's really painful.
It's really painful, and it's just at the top of your tummy there.
Just like that.
Okay. So do you feel it's more the pain that's hampering your breathing rather than that you can't breathe?
It's more the pain.
Okay.
Aaron had just had a sudden onset of abdominal pain. It was quite unspecific as to where the pain was, but he was quite uncomfortable, and it had come on all of a sudden, and he'd gotten quite concerned about it.
I had appendicitis one time,
Okay.
and there was an air pocket stuck by my lung or something like that.
Okay. Okay.
It's similar to that.
It feels the same.
It's similar to that.
Okay. I'm going to have a wee listen to your chest, so I won't talk to you for a wee minute, okay? Just try and breathe as nice as you can, okay? That's fine. Okay. Your lungs sound nice and clear, Aaron, so that's good. Okay. And I take it you've been out, have you? So have you had some drinks and stuff like that? Yeah. Did you have anything to eat before you came out?
Yeah, about like 7 o'clock. Yeah.
Okay, nothing unusual, nothing that would have upset your tummy or anything like that? And just alcohol, you're not taking any drugs or anything like that?
It's good to ascertain whether there is any drugs or alcohol involved. And in Aaron's case, it was just alcohol. There was no drugs, just a line of question, so that if there has been any drugs, that we can take that into account in our treatment plans.
Are you sore down here at all? Here?
Not there, it's more the centre, yeah, like there, yeah, there.
Okay. And have you been sick or anything like that?
No.
No.
No. I haven't spewed, or I haven't drank too much either, like,
Yeah. Okay.
I just started to breathe.
Okay.
More out.
He had no history of any abdominal issues. He hadn't eaten anything that might have upset his tummy. He hadn't even had that much to drink. I'm just going to have a wee listen at your tummy as well, okay? Just try nice and slow with your breathing, Aaron, okay? I know it's a bit painful, but we knew that he was in a lot of pain, which is something that we can help with, and we knew that it probably needed to be investigated.
Try and slow your breathing.
Yeah.
All right, good man.
Do you take any medication at all, Aaron?
No.
No.
Not
Normally fitting well.
normally, yeah.
Till tonight.
And it was just kind of all of a sudden, just like a flick of a switch.
Yeah, I'm not kidding. It was so strange. The pains
Okay.
going up.
Try and breathe through it.
In through your nose and then just out through your mouth, just nice and slow.
If you had to put a number on the pain, Aaron, 0 being no pain, 10 being the worst.
9.
9.
Yeah.
And does it start as a 9 or has it gotten worse?
Maybe an 8 at the start.
Okay.
As far as a diagnosis goes, pre-hospitally, an abdo pain is quite a difficult thing to diagnose. There's so much that goes on in your tummy, you've got so many organs in there. In Aaron's case, there was nothing to really pinpoint what was really going on.
See, for the next minute or so, go just pop your hands on your lap, sit back in the seat and just relax. Okay, just focus on your breathing. You get this heart racing. Go and sort of look up to where my nose should be. Okay.
Although we suspected Aaron's breathing difficulty was down to the amount of pain that he was in, and maybe a wee bit of anxiety surrounding that as well. But really with any breathing difficulty, and probably any abdo pain as well, just in case it's referred, or sometimes a higher abdo pain as well, could be related to a cardiac condition. It's pretty standard practice just to do an ECG as well, regardless of the age of the patient. Okay, everything's coming back looking okay, Aaron. Your pulse is up a wee bit, but then we would kind of expect that if you're quite uncomfortable with pain. Nothing else is really concerning. Your heart tracing's fine. But I think a wee trip to the hospital is probably going to be on the cards. because you're not at home and stuff, and we'll try and get your pain under control. Does that sound okay?
Yeah, that's fine. I've got, will it be fine by tonight, because I've got work tomorrow?
I don't know. It depends what they find at the hospital. They'll have to have a wee look at your tummy and stuff.
Okay, that's fine.
Aaron's night is over. Lisa breaks the news to his friend.
It was just to say that we're going to pop him up to the hospital. But there's probably no point coming. He's got his phone and stuff. He can keep in touch.
How's he doing right now?
He's all right. We're going to get his pain and stuff under control, but there's nothing alarming.
Breathing, is it better than it was when you first saw?
Yeah, his breathing's absolutely fine. It's just the pain that's kind of stopping him from breathing normally.
Honestly, you do your thing. But
yeah, he'll give me a shout. Okay.
Thanks a lot.
No worries.
Would you be comfortable lying down, Aaron?
Maybe, yeah.
Yeah, we'll maybe try it. We'll get you lying down and then we'll see if we can give you something for the pain.
The pain's worse. It wasn't as bad earlier.
Okay. Okay.
Right, my man, come and pop yourself down, okay?
Thank you.
We can move that bed sort of the angle of it to whatever you need.
Thanks, guys.
Right. Is that comfortable? Do you want to go up or down?
A little bit up.
A little bit up?
Yeah.
There?
Yeah, there's fine.
Okay.
Right, my man, we'll just pop this back on here.
Yeah.
We'll probably take your blood pressure a few times while we go. How are you with needles?
But your average person, like, almost in like, yeah, pass the needle.
Would you be happy for me to try and pop a needle in the back of your hand?
What for?
We're going to give you some paracetamol through the back of your hand.
Yeah, if you think it'll help with the pain.
Yeah, it works a wee bit quicker than if you take it orally.
I just won't look at it, like, it's just I don't like looking at it, that's all.
That's alright, you just
That's
look that
alright.
way.
You can look the other way. Does that feel alright, Aaron? You're not feeling any stinging or anything?
No.
No, good stuff. Right, you keep that hand still just for a wee minute. Thank you.
At least the music's good. I can hear the music from here.
There's a really nice smell outside. There must be a Chinese or a chippy or something.
I thought you were just smelling vodka or something.
No.
I was gonna say, I would never in my life, even when I was over class, as a good spec.
No. What we'll do is we'll get you all buckled up and we'll get you up to the hospital. Okay.
Alright. Thanks, by the way.
You're very welcome. Well, we're only around the corner, sort of 5 minutes away. So within about 15 minutes of him getting the paracetamol, although he was in a little bit of discomfort, he was much more manageable and his breathing settled down a lot and he was tolerating the pain much better. So the paracetamol worked a treat.
It's near perfect timing because this paracetamol is just finishing. I'll just give it a wee minute just for that last wee bit to run through. So we were sitting up at about an 8 to 9. What would you say we are now?
3.
Okay,
Yeah,
good stuff.
it's significant.
Good stuff.
The drugs have worked. Now Aaron will undergo tests to determine the cause of his pain.
Right, come on then, my man. Let's get you in. You grab a seat, and if you pop up your feet, I'll slip a wee board underneath. Okay. All right.
Thanks for your help.
So at least it's coming
I'm
through.
coming. You're not rid of me yet.
Couple of bumps till we get you in here, okay?
In Greenock, Karen and Pete are with 82-year-old Sarah, who has symptoms of sepsis.
Heart rate is quite fast, all right? These are all kind of signs of infection, all right? So don't worry, it's nothing that can't get fixed, all right? So we'll get her sorted. Right, 9-3, lovely.
She is confused and showing worrying signs of dementia.
So you've got all this equipment around you and she's no idea what's going on with her, what we're doing to her. We obviously, as a team, we do tell her what we're doing before we do it.
Are you coughing up anything, any kind of phlegm? All right. You know, even like extricating them, trying to explain what you're taking them and that, it's not easy. I think what we'll do, Sarah, we'll get you out to the ambulance, we'll get a wee chair, we'll get you lying down, more comfortable, so we can give you some fluids, all right? All right?
because she was an older lady, so she is more frail, she is more delicate.
You're all right, you hold on, you're okay.
And so we have to be very careful in how we move her. You can get comfy now, all right? We'll not move you again until we get to the hospital.
All right, I'll cover you up. Yeah, that's us. We're outside. All right, a wee bit cooler. All right, you'll see your arms a wee second.
Okay, yeah.
How are you feeling?
I'm feeling good.
Aye.
Yeah.
So maybe what a wee bit of oxygen does for somebody. Perks them up, you know.
For her journey to hospital, the crew need to make sure that Sarah can take on fluids and drugs if necessary.
Sure, that's what I'm right. What do you need to do when you're okay?
You're all right.
That's it.
Nearly done.
You okay?
Nearly done.
What makes it difficult is you're trying to make certain interventions. You know, you're trying to get oxygen on her, you're trying to give fluids, you know, and you're trying to explain to the patient what you're doing, but they don't understand.
Do you want him to take it out?
Just
Yeah.
oh, God, love that one.
It's tricky. It can be challenging.
The procedure is too distressing for Sarah, so Pete decides to leave it and get her to hospital.
What's up with your feet? You want me to give you a wee pillow and I can do it to make them better? Do you want them up a wee bit?
Yeah.
So you put the bed like that, is that better? Is that better?
Yeah.
All right. 2 seconds, I'm just getting a wee bit more comfy for her.
No worries. It's a bit different from training school to getting out into when you're in someone's house, and it's a bit more intimidating when you're out, but Pete was amazing. Yep. You ready, Sarah? We're going to move down in a wee second, all right? Right?
Yeah.
Right, there we go. We're on our way. We're on our way. Yeah, we are. We're on our way. Yep. What I've still to learn clinically, I can make up for in talking to people.
That's right, Karen.
There we go.
Ambulance service. Does the patient breathing? And I know that you're saying that you're within that park. Whereabouts within the park are you?
In the ambulance control centre in South Queensferry, Amber is trying to pinpoint a caller's location.
It's important for us to know exactly where the patient is, because if we don't, then that obviously delays the time in being able to get treatment for the patient. What 3 words? Okay, no problem, I've got you there, thank you.
The caller uses a phone application called What 3 Words to identify their exact location.
It's helpful from a call handling perspective, and also for crews on the road and also dispatch. Those 3 words give us a 3-metre location for where the patient is, and we change it into coordinates. She slipped and fallen, okay. And she's now slipping down the hill.
The caller is helping a woman who may have broken her ankle.
Now her ankle is obviously bent out of shape. It is, okay. I'm organising that help for you now. If you stay on the line, I'll tell you exactly what to do next. Her toes were going cold due to the fact that there was an obvious break within the ankle that can cause the circulation to cut off, which can be quite serious. Okay, don't move her unless it's absolutely necessary. Okay, just tell her to try and be still and wait for the help to arrive. Okay, obviously I understand the situation that you are in though, okay?
A crew is on their way, but the caller is concerned the patient is slipping further down the hill.
Okay, just going to pop you on a quick silent hold though, okay? Bear with me just one moment. Hannah? She's on a hill.
Okay.
She's got an ankle fracture, she's not alert, she's now feeling faint. She's sliding down this hill.
Is there anything they can put in front of her to try and stop this, just to put like a barricade for her going further down the hill?
Okay. Hi, sorry about that. So I was just obviously taking some advice from my supervisor. Do you have anything there that, like, so you can prevent her from sliding any further, or? So you're currently holding her up. Okay, right, bear with me. He's sitting in front of her, holding her up to ensure that she's not going to fall down down the hill.
Okay.
But he's like, he's beginning to slide.
Slide as well.
Yeah. I remember the gentleman stating that he was scared he was going to end up letting go because it was getting wet and it was getting very slippery.
Because they're trying to think about sort, because obviously for the Wolverine, will any vehicle get up that path? So like quad bike size to, do you know what I mean? Because they're obviously going to have to get kit to them.
Yeah, okay.
Supervisor Hannah decides to dispatch a special operations response team and their off-road vehicle, the Wolverine.
It's a specialist vehicle that our SORT teams and specialist teams have to be able to get to patients in abnormal or difficult situations. Would any vehicle be able to get up there, or you don't think you would get an ambulance up? Okay, so do you think you would be able to get like a small off-road vehicle up to yourselves? Possibly. Okay.
As well as SORT, a regular ambulance crew are also on their way.
Obviously I know that it is getting cold outside. You are doing really well, okay? Just do the best that you can to try and protect each other from the elements, okay? We're doing everything we can to get to you, okay? Showing a little bit of empathy down the phone to someone, it does go a long way. It can be really reassuring, like a calming tone on the phone. If I'm stressed out, it's not going to help the patient at all. You can see them. Okay, right, I'll leave you with the crew then, okay? That's no problem at all. Right, take care. Bye-bye.
In Paisley, ambulance technician Karen and veteran paramedic Pete are responding to a 999 call from a 78-year-old woman with chest and back pain.
Just keep me right with the navigator.
Karen has only recently finished her technician training. She is now getting the hang of driving an ambulance on Scotland's roads.
Nice. Off-road, like it. Did you like your driving course?
I did like it, yeah.
Hated mine.
It was scary to start with, but once I got the flow.
When you work with new members of staff, one thing that you notice immediately is that they're enthusiastic. You know, that they're excited.
Pete made me feel very comfortable. He didn't make me feel like I was a student. I was a part of his team. We were together. We were working together.
Just smell this job's in Dumbarton, aren't you? You're about 20 minutes to get a scrub on.
So Pete was a good support. Kept me laughing.
Likewise. Likewise.
See, when you go to jobs like Dumbarton and all the rest, you realise it's obviously every Vale leaving crews out.
Yeah.
Helensburgh's probably out. The fact they're sending you and Paisley to that.
When an emergency call comes in, just the nearest, most appropriate resource will be sent, and sometimes you do get sent distances.
Oh God, right, what do I do here?
Just go round.
But there's a hearse.
No. They'll understand.
Oh, R.I.P.
There's that one there. Look at that view.
Isn't it?
What a view.
The patient, Betty, is experiencing these pains for the first time. She's dialed 999 herself.
I'm Peter, by the way, so that's Karen.
I got up this morning, Peter, right? Really bad pains in my back, my chest, and all down this side. And I've had a heart attack before.
When we go in, we're looking at her colour. Is she talking to us? Is she communicating? Is she acknowledging us when we walk in? What she was, which was great.
So pain at the centre of your chest, and it goes through to your back and down your right arm. Your right arm.
Is it a constant pain? Is it intermittent?
No, it's just actually, but now it is.
A constant. But if you get a pain score, right? 0 is no pain, 10 the most you've ever felt in your life, what would you give it? Okay. All right. Have you been sick? Do you feel sick?
No.
You feeling short of breath, dizzy?
I started being kind of breathless right enough now, but after that COPD.
Then we want to take a history from her. What's happened? What's been on? How long has it been going on for? Does she have a history of heart issues? And then we go through, it's what we call an A to E examination. So we go through a checklist of everything.
Listen, we're going to do a whole load of checks on you here, all right?
I'm just going to start poking and prodding and stuff, so
I'll look at it.
if you're all right with that.
That's fine with me. I've got diabetes, by the way.
Right, okay. Have you eaten today?
No.
No? Okay.
No.
Right, sharp scratch Betty in 3, 2, 1. Well done. 9.2 for you.
What we're essentially querying this lady is acute coronary syndrome. And that's a collection of conditions that causes chest pain or discomfort. One of the things that can be causing this is, in this lady's case, a heart attack. So it's vital we do a 12-lead ECG as early as possible.
I'm just going to start sticking you with wee things, all right? Just pop that wee one round. Perfect.
We'll see you've still got that pain, and we'll certainly just give us a few more minutes, all right? And we'll give you some pain relief. We'll get it managed, all right? But so far, so good.
A 12-lead ECG, or electrocardiogram, will give the crew a detailed picture of the rhythm and electrical activity of Betty's heart.
We'll have a look at this ECG, okay?
That's us measuring just now, so nice and still.
There are several different types of heart conditions, from heart failure to heart attack to cardiac arrest. Knowing the difference as a paramedic is crucial.
A cardiac arrest is where the heart's either stopped or it's quivering, it's fibrillating. A heart attack is a partial or full occlusion of one of the coronary arteries. And heart failure, essentially the heart's still beating, but it's the pump's failing, so that you're getting blood, it's kind of backing up. You'll see swelling extremities. Right. We'll always take 2, Betty, all right? So we're nice and still down, all right?
Depending on the individual, it could be radiating different places. Men are generally down your kind of arm. Ladies sometimes can have abdominal pain, lower back pain. So it's really important to make sure that you ask so many questions to each individual.
Your ECG looks absolutely fine. The difficulty we have here, you know this yourself from your previous heart attack, you can have 2 types of heart attack, okay? You can have one that you'll see on the ECG and one that you won't. The only way to rule out a cardiac event such as a heart attack is actually a blood test, which we can't do here, all right? So we're still going to advise you go to the hospital, all right? We're going to give you a few medicines just in case, all right? We'll give you some pain relief. So we're going to give you, we're going to spray a GTN, all right? Have you been prescribed that before? Kind of re-sprayed it? Aye. The reason people get it, it's a vasodilator, so it just opens up all the vessels. So if it is a bit of kind of, well, the artery's constricted, it allows more blood, more oxygen.
GTN, or glycerol trinitrate, widens the blood vessels, and by increasing the flow of blood to the heart, eases chest pain.
2 sprays this, darling, okay? You okay? You all right? Aye. That's nothing to do with the drug, that's a calming bedside manner, Betty. That's nothing to do with that, right? That's it, just glide. You will just glide down there, all right?
2, 1.
All right?
3, 2, 1.
2 and 3.
3, 2, 1.
Are you okay?
That wasn't too bad, was it?
No, it wasn't too bad.
With Betty's observations stable and her pain under control, she will be taken to the nearest hospital at Vale of Leven.
No, that's good to go.
Cool.
It's just a wee SATS probe done. You comfy?
Yeah.
It's a short drive for Karen, and her first journey to this hospital.
See under that canopy there?
Yeah.
That's where we're going to kind of
Right, okay.
put the back end of the ambulance, because there's the door right there, all right?
Yeah.
Right, let's get you in.
We all good?
All good. All good.
Right, Betty, this will be an experience, I know. Oh no, you're all good.
It's like walking a plank, innit?
Isn't it?
Don't worry, Betty, we've no dropped in an hour, right?
At hospital, Betty will have the source of her chest and back pain further investigated.
Mind your elbows.
There we go. Fabulous.
The Scottish Ambulance Service responds to around 1.6 million calls per year.
It's ambulance service. Is the patient breathing?
In South Queensferry, west of Edinburgh, emergency call handlers like Amber answer 999 calls from people in different medical situations.
Okay, tell me exactly what's happened.
The job can be stressful, but immensely rewarding.
Even getting a thank you at the end of the call is lovely. Knowing that you've helped someone when a crew arrives there on scene, it's really rewarding. Okay. And how old is it?
This caller is with a child who has swallowed a small object and is now choking.
Is he completely alert? Okay, and is he breathing normally? When a call comes in for a child choking, you have that natural instinct of the fear of, are they breathing at all? Are they able to get any air in? Right, I'm organising the help for you now. Stay on the line. I'll tell you exactly what to do next. Do not slap him on the back. Okay, are you right by him now? Okay. Look at him very closely, tell me exactly what you see and hear him doing. It was important for us to know that the child could cough and that the child was able to talk, and it was really reassuring that he was even saying ow and that it was sore. I know it doesn't sound nice, but it meant that he was still able to get air in and it wasn't a complete obstruction. Okay. Okay, so just watch him very closely and do not slap him on the back. If he starts wheezing, making funny noises, or becomes unconscious, then tell me immediately.
Because there is no health professional present, Amber advises against slapping the patient on the back.
Everyone slaps at different forces, and this can lead to further injuries. This can also lead to the item dislodging, and may end up going from a partial obstruction to a complete obstruction. What size was it? Is it a big thing? Or? The more information that we gather at the time of the call, it's better for the crews. It gives them an idea as to what is happening before they get there on scene. You're doing really well. We're getting the help to you as quickly as we can. Okay, you're doing great. Trust me, from a parent myself, I know what it's like to be scared when there is something wrong with your child. It's horrible, but it's just reassuring that we are there and we're coming. Let's just say the crew have just marked us on scene. Okay, so we'll be up with you in just a moment. They'll just be grabbing their equipment. Okay. Okay, right, take care. Right, bye-bye. There's times these calls can lead to being quite upsetting, so it is important to just take that moment just to walk away from the phone just for a moment to regather yourself before going back onto the next call. But yeah, I was once that parent that was panicked on the other end of the line, and it does happen. We're human just like everyone else. Hello, it's ambulance service. Is patient breathing?
Paisley crewmates Karen and Pete are on their way to a toddler who has suffered a convulsion.
Oh, we 2-year-old.
Oh no!
Right, okay.
Febrile seizure.
999 road activated.
Stay left.
Left.
Every case is a priority for paramedics, but ones involving children are especially concerning.
With adults, you normally will see a kind of gradual deterioration where you can make your interventions if needed. Kids, they will plateau, they will go so far, and then all of a sudden they will just deteriorate within a couple of seconds.
Paramedics have specialist guidelines to follow when dealing with very young patients.
Right, let's have a little look.
What's your page for age?
So, for a 2-year-old, we're looking for heart rate between 95 and 140 beats per minute. Respiratory rate between 25 and 30. It's a lovely wee name for that girl, isn't it? Faith.
It's a beautiful name.
Joe, so I've got 2 girls, right? I'll tell you this. It's just as well me and the missus did have 2 girls. We could never agree on a boy's name.
Pete, obviously, he's got his own kids, and that gives an extra kind of anxiousness about it. I don't have kids, but I still feel that that tension.
While Karen's in the first few days of her new role as an ambulance technician, Pete's been in the service for over 12 years now.
One thing I do like about this job is no 2 jobs are the same.
17, 27, on. It's back away.
Every job is different, but also the environments you work in are different. Sometimes you can be in a patient's house. The next job, you're in a football field. The next job, you can be at the side of the M8. I've seen myself halfway up a mountain before. You honestly don't know what you're going to get next.
Fab. What is it, 02 in it? Okay.
My approach is always the same. Take time in your assessments, make people comfortable, and if need be, convey them to hospital.
Hi, how you doing? You all right? Hello, darling. Hello. So what happened?
The crew find an upset Faith with Mum and Gran.
She's kind of been up and down all day kind of thing.
She was okay yesterday, I take it, yeah? Fine
Yes,
yesterday,
yeah, she was fine, absolutely fine yesterday.
Okay.
And I said, right, Mum, we'll try some lunch. Because she normally gets a lunch at 12. And she went to take a lunch. And then she's a brilliant eater, so I know that.
That's something, yeah.
An hour earlier, Faith had a febrile convulsion that lasted around 10 seconds.
Febrile convulsions are caused by a rapid spike in temperature. Now, when you go to children, it could just be their immunisations. They've had an MMR, there's a side effect of that, but it also could be a potential infection, bacterial or viral. So you still, although we're not concerned about the seizure, something's caused the fever in the first place, and we need to find out what that is.
Although usually harmless, this type of seizure can happen to children between the ages of 6 months and 3 years old. It's Faith's 5th in 2 years.
You have to bear in mind with kids, their symptoms are very vague, and the parents can only tell you what they know or what they've witnessed. So when you walk in, a child's going to clam up. So if you want to do your checks, she's not going to let you do it unless you try and win her over in some way.
It's just a wee probe, guys, nothing to worry about, all right? So the light goes at the top, so it shines through the nail bed, all right? Then you put that wee bit at the back, all right?
Cool.
Sorry, darling, give me 2 seconds.
You don't want to take away their trust in the medical profession, because if at that age they think you're just going to come in and hurt them, that can give them a lasting fear.
So what happened was I gave her actually another calcium, and that was 22 minutes past 5.
Yeah.
So the calco doesn't seem to be as if it's working.
Alright. 39.3.
39.3.
She got a nappy on her pants or something? Just going to strip her down, are you happy with that? It's just too hot, so we need to...
At 39.3, Faith's temperature is worryingly high, even after several doses of paracetamol.
Obviously she's had this febrile convulsion. We would still recommend obviously she goes up to the hospital, all right? She's still got a raging temperature. And as I said, I know it seems cruel, but we're trying to cool her down a wee bit. And see, once we're out in the ambulance, We can cool it using aircon as well. I've got no doubt it'll come down, all right?
I mean, to be honest, it's our temperature's no like move since I've gave her Calpol like the day at all.
See, when the temperature starts to come down, the numbers will normalise and she'll start to feel better. You know what I mean? But as I said, we need to find out what's going on, all right?
Any child under 2 is taken straight to hospital. Obviously, you can't force parents to allow us to do that, but you know, you have to set out the kind of pros and the cons. But most parents want their wee one to get checked out, and as we would as well.
Right, wait, see this.
As they travel to hospital in Glasgow, Pete pulls out all the stops to keep Faith distracted.
An elephant. You want to hold it?
Do you want to try it?
I had a wee stepson, Lewis, and unfortunately he's no longer with us, but he was in hospital quite a lot. So when we was in hospital, we used to make all these, just to try and entertain him.
Just got the aircon on, all right? Yeah. You might get freezing with that, but
no.
Cool the lane, right?
No.
But do you know, I sometimes put on music as well. You know, like I used to have I don't know why I didn't do it in this case, but normally you've got your phone, you go and you get, Apple Music and get a bit of Frozen and they go, do you know what I mean? Just make it a bit of a laugh then. But as I said, you can still do your job, you've still got the aircon going, you're still keeping it monitored. Do you know what? There's no reason you can't have a laugh at the same time, you know what I mean? So
Pete, don't lie, you enjoyed that more.
I think I got more out of it than she did, because she was just sitting there like, no, that interested, you know what I mean? But
what's your name? I'll write it on your hat. Is it Faith? Yeah? This is a work of art, Faith.
They've arrived. Faith will be taken in to check the cause of her fever and subsequent seizure.
By the time we arrived at the hospital, our temperature was 37.2, so we've got it back to where it should be.
I'm just going to support your arm, all right? It's like climbing a mountain, isn't it? There we go.
Thank you.
All right. Let's get her in. We'll just round this way.
Livingston, the second most populated area in the Lothians after Edinburgh. With over 55,000 residents keeping the station's ambulance crews on their toes.
This is summer, just today. This is summer.
It's nice that there's a breeze though, isn't it, as well, but it's quite windy.
Team leader Karen and paramedic Johnny are en route to a patient that may have fainted in a local charity shop.
So we've got a 71-year-old male who's fallen and has a head injury, and he's vomiting as well. So.
It's in the house?
Oh, in fact it says Bernardo, so it's going to be the shop, isn't it?
It's one of the hottest days of the year, which could be the reason the man has blacked out.
Oh, what would you be doing the day if you weren't here, Karen?
Well, I feel like I need a little sitting in the garden day, you know? Not that I'd be in the padlock room, but...
The wee man, yeah.
Team leader Karen is proud of her station's camaraderie.
We're really good for sitting in the mess room and chatting and talking to each other and making sure each other are all right. And if somebody thinks someone has been upset at a job, even if they don't say it, I think we're a good station for making sure that person's all right and checking up on them.
Oh yeah,
somebody's on the road.
Somebody's standing there, yeah.
Is that a wee bus stop?
Yeah.
But...
Have ambulance will travel. We'll get up there, won't we?
Oh no, it's not. It's just the pavement. I'll just laugh.
Right, let's go and see what's happening. I'll grab that.
The crew have been told that the patient may have suffered a head injury after his fall.
Sorry, it's through the back.
Through the back?
Right, no bother.
Hello? Oh, where are we hiding? Through here.
As I'm walking in, what I'm thinking is, how am I going to get this person out? So as we walk through, I think if he can't walk out himself, this is going to be a bit of a challenge, but luckily when we went through, he was actually right next to the fire escape.
So what's happened? How come you're on the floor?
I wasn't feeling too great when I come into there. I was very, very tired.
Uh-huh.
And I was walking, I was sort of toiling, walking. So I had a wee glass of water. I sat on the stool, next thing I knew I was off the stool and onto the floor.
The patient, Alan, is a volunteer in the shop.
I've obviously went down, woken up.
Uh-huh.
Then got up again and thought, I'll just have a wee seat and a cup of water, and before I knew it, I was standing and fell to the floor.
So this happened twice?
This happened twice, I was on the floor.
Right, okay, okay. Do you know if you were knocked unconscious or anything like that?
It wasn't very little, very, very...
Very brief?
Very brief, very brief.
Staff had tried to get him up before we got there, and he'd had a secondary episode that had caused the head injuries.
I can see that wee cut above your eye. So I'm just going to have a wee feel at your neck, okay, just to make sure that you don't have any pain anywhere. Just stay nice and still for us, Alan.
The crew begin their standard checks to be sure Alan is not suffering from a concussion.
Can you touch your chin to your chest, okay? And can you look over to the right and can you look over to the left? Okay. And is your vision okay? Are you not seeing anything double or anything like that? Your blood pressure is a wee bit on the lower side of normal, but it's not worryingly low. Any headache, any dizziness?
No.
No. You feel okay?
Yep.
Okay. So were you actually sick, or was it more coughing up phlegm?
I think it was more phlegm. I think
Phlegm.
it was more like a phlegm.
Good, okay.
I've had that for a couple of days before you got phlegm.
Have you?
So.
Okay. The reason I'm saying that is it's good that you're coughing up phlegm rather than vomiting, because you have bumped your head, so vomiting's not the best sign if you've got a head injury, but you've not been vomiting, so that's good.
Our main concern with this chap was that he was normally quite fit and healthy, had had a short period of being unwell leading up to the day's events, and then we had this faint or collapse episode that was not resolving.
Have you taken a wee COVID-19 test just with having a cough?
Not this week. I've not taken anything this week.
Okay. It might be worth doing one just with the symptoms. You've not had any episodes of chest pain today?
No.
No, that's good. Okay.
As books and clothes continue to be sorted, the crew wait to take another blood pressure reading, this time with Alan sitting upright.
So take your time, and can I give you a hand to your feet, or do you want to use the worktop? So it's just this blood pressure that we just need to keep an eye on. Do you feel okay now that you're sat up?
A wee bit. I'm still a wee bit light-headed.
A wee bit light-headed. Well, just take your time. Relax back into the chair. All right? Yeah, we'll give you a wee drink of water. Would that be okay?
Yes, please.
Yeah. Do you feel hot?
Thank
Yeah, I've got
Yeah.
I'll get you to take it in that hand, that's all right.
They've gone down, is it?
64.
Okay, so your blood pressure has gone down quite a wee bit there when we've moved you. I think what we'll do, Alan, is because your blood pressure has dipped, we'll get you out into the ambulance.
Every time we tried to mobilise him or sit him up, his blood pressure dropped, but he also became quite symptomatic. He became quite pale, quite sweaty, and complaining of dizziness.
The decision is made. Alan needs to be taken to hospital for further checks.
I'm roasting.
It's boiling. This is going to be one of these days, Alan, that the air conditioning is on 24 hours, blasting.
Before he leaves, the shop's deputy manager, Marina, sees Alan off.
What you'll do to get away from the books, Alan? Who's going to do my books now?
We'll get them fast-tracking us back to you.
Yeah. Take care, Alan, and
Thanks for everything.
do not rush back. We'll see you soon.
Thanks.
No
Thanks,
problem.
Thanks, lady.
No problem.
All right. Good to go?
Yeah, happy to go, Kaz. Just going to take your blood pressure one more time. Sure you're okay for a drink? You don't want some of your water?
Oh, please.
That's fine.
Before Alan goes into hospital, he's tested for COVID-19.
The patient tested positive for COVID-19, which was a bit of a shock because although retrospectively his symptoms did make sense, he wasn't overly short of breath. I don't think he had a fever at the time.
We're going in, that's us. So try not to worry about the fact that your test is positive, all right? It's
a surprise.
Yeah.
He'd been fully vaccinated and everything as well, but it maybe explained why he'd had this period of being unwell and this collapse.
Nearly 3 years on from the start of the pandemic, the virus is still hospitalising the worst hit.
Oh, we need to pop your wee mask on.
He's exempt.
Oh, yeah, that's fine.
But paramedics are now more accustomed to carrying COVID-positive patients.
It's not as much of a panic as it was in the beginning when we didn't know what COVID exactly was.
I think because it's so common now, we are used to it. We're always looking out for it, so any signs of infection for any patient, so it doesn't really change the way we work.
He was a really nice chap, actually.
He was lovely, yeah.
His blood pressure just didn't recover at all.
No.
It
was a bit weird, but I suppose the COVID explains it.
Right.
Go for it.
Happy to go?
Mm-hmm.
All good.
Next person fainting in the heat.
Yep.